Hi everyone, Gareth Presch, founder of the World Health Innovation Summit. I decided to make a couple of short videos over the course of the next few weeks, more of an explainer around what we're doing at the World Health Innovation Summit. I've just recently come back from UNGA, UN General Assembly, and I met quite a lot of people in the States and from people all over the world, and they've been kind of asking me for a little bit more information about, what we're doing. How did the World Health Innovation come about? And I thought I'd just kind of try and go through a couple of slides and explain exactly the opportunities and sort of look at the future of healthcare. Firstly, I just wanted to thank everyone who's joined us on this journey. I nearly 25 years working in the health service. I was the former chief officer of the National Haemophilia Council in Ireland. I spent my entire career trying to help people through health and social care means. Worked in the NHS, was part of district nursing in Cumbria, also worked in e-health. Previously in the Irish Health Service, I worked in, acute hospitals, primary care, estates management, health promotion, acute hospital, all the different sectors. And I really enjoyed my time. And basically, the reason why I set up the World Health Innovation Summit was because of the pressures that we were under. And the particular focus at the time in 2014, 15, when I had the idea, was to try and attract staff into the NHS, particularly locally here in Cumbria. So the idea was to create a global healthcare platform that you could attract staff. That was the initial concept. And of course, the idea kind of morphed and became a lot more. I realized the potential and the opportunity to create programs in schools and the workplace and kind of look at different ways that we could actually give people the tools to manage their own health and well-being, effectively prevention at scale. And so the World Health Innovation Summit is that platform. It's able to bring the public and private partnerships together, and it's a way of delivering new models of healthcare. And we've seen this, we've been doing it successfully over many years. We prototyped it in 2015 to 2018 here in the UK and around the world with our partners. And we had £1 invested, 36 back. That was the social return on investment. It's a huge opportunity to create new and meaningful jobs. And I think that's the opportunity that we have. I'm working also as part of the Global Social Prescribing Alliance. So you can see that we can create, new jobs through link workers and various other activities through social prescribing. So that's one opportunity that I'd say we've created with our partners. And the other thing to say that, very much the situation at the moment and the reason why we created the World Health Innovation Summit is because of this huge problems and challenges that we face in the health sector. And I think this is important to emphasize that we are also a social enterprise. We're a community interest company. The idea is to create value, a new platform, new ways of doing things. On a global scale, you can generate income streams through your activities. The more people invest in us, the more money we can return, the more value we can create, and we can reinvest that back into new and meaningful jobs. Very much like the modeling of many businesses that we see out there at the moment that generate a lot of value. But our mandate and our idea is to create that value and then reinvest it back into the community. And I think that's unique. And I think it gives us quite an opportunity globally to scale these new platforms, new models of healthcare. And then I think it's very important to emphasize that it's about teamwork. It's about working collectively, also building trust. And I hope that I can, over the next couple of weeks, kind of do a few more of these kind of Q&As as well, and take any questions around sort of how we can all do this collectively. I think we're at a crucial point in time. We need to deliver the Sustainable Development Goals. We face many challenges with climate change and various other things happening in the world. We're all very aware of what's going on in the world at the moment. We need to be able to demonstrate that we can work collectively. I believe health can be a strong, should we say, driver of change. And I hope that you will join us on this journey. So let me just flick through some of these slides as well and give you an insight into what we're doing and what we plan to do and how you can get involved and help us and support us, because this is very much about industry as well. Reaching out to the investment world, to those in philanthropic areas. Come speak to me, let's talk, let's work together, let's look at how we can create these programs together. Banks, institutions, investors, companies. We want to create industry excellence partnerships. So reach out, contact me through LinkedIn. And let's start getting these things moving. I think we need to create ways and means to work together more successfully, particularly bridge the financial sector, the health sector, and all the other sectors that need to come together. The 17 UN development goals gives us that sort of like that kind of target. And I think we should look to see how we can work together more successfully and more meaningful. On the presentation. Hello, my name is Gareth Presch, founder of the World Health Innovation Summit. 3 years ago, I sent a tweet out from Carlisle, Cumbria, asking our community to understand. Hello, my name is Gareth Presch, founder of the opportunities that we have here, and our mission and our vision. I wanted to demonstrate as well. We have demonstrated this in the UK. That was one of our events with Nottingham, and it can give you real insight into how you can mobilize people on a very large scale and then create value for the city as well. So we want to, create real opportunities, empower communities globally, and we want to improve people's overall health and well-being and also support local economy. And we believe we can do this through a circular economy, and the WHIS platform brings patients, clinicians, managers, voluntary sector, education, and the business community together to create value while supporting our health and social care services. I think it's really important to understand the value proposition here. We're talking about creating a lot of value. Health is wealth. We've seen that with COVID. If people are sick and unwell, they can't have a job. You can see that in the UK economy. There's over 2.5 million people out sick at the moment. It's about 170 billion on the economy. And we want to create this public and private healthcare partnerships where we leave no one behind. And we want to create a healthy city index. We want to create an ESG kind of framework where we can move with investors, and we can create new models of financial instruments that we can actually deliver these services for people in need. And I believe this can create a lot of new jobs. I've been kind of putting this value proposition and been presenting this all over the world. And I think there is a substantial opportunity here to create new and meaningful jobs. For every pound invested, you can get 36 back. That's the opportunity. The health sector is a huge sector. It's worth over, $8 trillion. The wellness sector is worth over $4.4 trillion. And we've seen that during COVID, we've really seen how health inequalities exist across the world. So we really need to tackle this and address this. And hopefully at COP, we can also work in partnership with climate. I think climate change is the next challenge, but also at the same time, the health system is under so much pressure. This is just some of our impact, and we had our programs in schools and that. And I just, we were improving people's emotional well-being and resilience in young people. And we really did show that this can be done. And then we had this opportunity, and I wanted to talk about our team as well. These are the individuals who are supporting me and WHIS and working together. Amir, Deirdre, Ben, Nisa, and then we've so many others in the advisory: Courtney, Sunita, Mark, Dr. Alan Smith, Professor Leif Edvinson, who's been a real friend of mine and has shared so much knowledge with me and helped me go on this path. And then we've so many people in the experts, so many ambassadors who are championing our work and helping me and helping us to kind of deliver this new model of care. And what I wanted to kind of talk about was this timeline as well, and where we're at the moment and what we intend to do in the future. We had our proof of concept from 2015 to 2018. We did a lot of work around SDG cities. We finished that up in 2022. We had a lot of people. We were working very successfully on new models of care. We launched the Global Social Prescribing Alliance with our partnerships, with our partners. And now that's taking a new model as well. We're bringing that forward in terms of being able to engage with investors and be able to scale up social prescribing and work with governments. And I really think that this is an opportunity for our future. I hope this gives you a bit of an insight into what we've actually been doing and our journey up to this point. I felt it was necessary to kind of, give a short sort of 10-15 minute summary of our progress up to this point. It's important to note we are a social enterprise. This has been set up, to kind of work with communities, build that trust. I think now is the perfect time to kind of scale this up. Very excited for the future. As I said, we are now looking to work with investors, philanthropists, industry excellence partnerships. These are the sort of activities that we want to kind of scale and build on. There is a huge opportunity. There is this huge need as well. I think we're all well aware of the pressures our health services are under. Aging population, growing population. We'll have another 2 billion people on the planet in the next few years. We don't have enough healthcare staff. We won't have enough healthcare staff. People need to be aware of that. Our services are diminishing. Some services don't exist in some of these areas globally. For example, in digital, there's nearly 2.5 billion people who don't have access to the internet. They have absolutely zero access to healthcare. So these are massive opportunities, and I hope over the next few weeks that we can work together, next few months, next few years. This is going to be a platform that grows, develops, really shapes, works with people and wants to shape a positive future. It's a collective opportunity, and I sincerely hope that I've given you over the last 10 minutes an insight into our work. You're very welcome to join us. Please check out our website. Everything we do is open source. We want to work with transparency, honesty, and integrity. And I hope you can join us on that. So, reach out. As I said, we're very much engaged in this new financial model, how we can create value, how we can create new jobs, how we can actually improve people's health and well-being and create this new economic model. So join us, and I very much look forward to working with you over the next couple of weeks, months, years. This is going to be a big job, and it's a big opportunity. So I hope that gives you an insight into what we've been doing and our journey so far. And thank you very much to everyone who supported us up to this moment. One of the things I've learned on this journey is, the support has just been incredible. I've had so many opportunities, and I'm very much looking forward to expanding on those opportunities over the next few years. So thank you very much, and I hope you've enjoyed this video, and do reach out, and I'll post some more videos over the next few weeks as we build up the COP. We've got a number of activities building, and then also I'll keep people updated regularly on our progress. So for me, thank you very much, and we'll talk soon.